Yes, greetings from Study on Health Services. Today, I want us to talk about prostate cancer. As we are all aware, the trends of cancer globally are on the rise, not just for prostate cancer, but for all other cancers. Statistics show that cancers are one of the fastest rising chronic illnesses that have been increasing over time. But for today, we are going to talk about prostate cancer. And prostate cancer is one of the leading causes of death among men, especially men that are above 60 years. You see, as a man grows, the prostate, which is at the entrance or at the exit of the urinary bladder, tends to become thicker, and so this gives an opportunity to the cancerous cells to start developing within the prostate. So this rise has seen so many men passing on, and the challenge is that this prostate cancer is usually detected late. Prostate cancer comes as a result of a number of things. For example, age, as I've already said. A man who is 60 years and above has close to 70% chances. A man who takes a lot of fatty foods for over a long period of time may have an increased chance or risk of developing this prostate cancer, because these fatty foods tend to cause thickening of the prostate gland. The other risk factor is the fact that when you're a male and then you are black, like when I say black, I don't only mean being dark skinned, but I mean having an ethnicity of a black person, because prostate cancer is common among black men than in the whites. So there are so many other risk factors. Having a history of prostate cancer in your family can increase. Prostate cancer has 4 stages. The first stage is when there is that growth within your prostate, but you do not know, because as we have said, this cancer grows slowly by slowly. You may not actually detect that you have it. And so what happens is that it keeps growing slowly by slowly. It starts as one cancer cell, then it keeps growing. Then it goes to stage 2. Still in stage 2, it may that lump, we call it a lump or a tumor. It keeps growing, but it is not yet detected, because sometimes you have not started experiencing symptoms. Then stage 3 is when it has grown, and it now, because the urethra, the tube that passes urine from the bladder, is going through the prostate. Usually at stage 3, it has, that growth has started pressing on the urethra, so you may start experiencing some symptoms, like for example, urinary retention. You go and you don't urinate all the urine out. Maybe you have started experiencing some pain in the prostate, or you have started experiencing low abdominal pain, pelvic pains, but usually still it may not be so much. At stage 4 is when it has grown, but we also have to understand that when prostate cancer sets in, sometimes at stage 4 it has spread across other surrounding organs. So as men, it is very important that we always take steps and prioritize our health and be sure that we do not have this prostate cancer, because most men are dying because of this prostate cancer, other than other forms of cancers. Thank you so much.